question, one follow-up. And with that, I'll turn things over to Dr. Moore to get started.
Good afternoon. I hope you had a safe and enjoyable long weekend. Today, there are 164 new cases of COVID-19 in Ontario. There are 71 people in hospital, 106 in the intensive care unit due to COVID-related critical illness. And I'm sorry to report that there have been 2 more deaths from COVID-19 over the last 2 days. A total of 11,515 tests were processed yesterday with a percent positivity of 1.4%. Please, if you have any symptoms of COVID-19, continue to get tested so that public health can do the great work on case and contact management. We are paying very close attention to how the numbers are trending, both in Ontario and elsewhere, as we move towards the fall. As of today, more than 19.5 million doses of COVID-19 vaccine have been administered in Ontario. This tremendous collective effort means that we have surpassed our target of having 80% of Ontarians aged 12 and up vaccinated with 1 dose. Our first dose percentage is now 80.5%. This is truly remarkable achievement and one we should all be incredibly proud of. We are just over 5% away from meeting our second dose target of 75% at a provincial level. Even after we reach our second dose goal, we want to support high levels of vaccination across the province and need to ensure no public health unit has less than 70% of their eligible population fully vaccinated with 2 doses. I would like to both congratulate and thank all Ontarians who have gotten vaccinated and helped us move forward on our journey towards a new normal. And I want to continue to implore people to go out and get vaccinated. Since December 14, 2020, unvaccinated cases of COVID-19 accounted for 95.4% of COVID cases, with breakthrough cases accounting for only 0.5%. This shows how well vaccination is protecting people in Ontario from COVID-19. And in the last month, people who were unvaccinated were approximately 8 times more likely to get infected with COVID-19 compared to fully vaccinated individuals. And unvaccinated adults 60 years of age and older were approximately 15 times more likely to be hospitalized due to COVID-19 compared to fully vaccinated adults 60 years of age and older. We all know that the Delta strain, currently the dominant strain in Ontario, is more transmissible than the original COVID-19 strain and more likely to cause severe disease. This data shows that these vaccines are safe and very effective at preventing you from being hospitalized, admitted to the intensive care unit, or dying from this disease. I would once again like to highlight the great work done by our local public health agencies in Ottawa, in Waterloo, Thunder Bay, Leeds Grenville Lanark, and Halton, amongst others, who are leading the way in achieving high vaccination rates and good protection for their communities. Thank you all for your efforts. I know achieving such high vaccination rates is no easy feat and requires a tremendous amount of hard work, collaboration, and community patience. But to all those who played a part in this, your work is saving lives. As a result, your communities will be safer going into the school year. And to the major metropolitan areas in the province, we need your help to increase our vaccination rates. Your success is our collective success in Ontario. We stand behind you in your efforts to get shots in arms and help us exit the roadmap and ease the majority of public health measures. We also need some of our age groups to pick up the pace of vaccination. In particular, the 20 to 39-year-old age group is in the low 70% protected with immunization, and almost 60% of those 12 to 17-year-olds have 1 dose, and only 48% of that age group has their second dose. When it comes to our children, I am elated that they are going back to school this September. It's great news for our kids. They will be back with their classmates, where they can get back to activities like music and theater and sport and develop those friendships that can last a lifetime. This is crucially important to their mental, physical, and social well-being. But it's also important to do so cautiously and carefully. So we will need to maintain some level of public health measures for now in our school settings. Schools are safest where we maintain high rates of community immunity, high testing, good case and contact management, and high immunization rates. So it is our duty for our schools to remain safe by getting immunized. This means also that students grade 1 to 12 will be required to wear a mask while indoors. Our goal is to have a safe reopening of our schools that lasts the entire academic year. Wearing a mask is a proven way to help mitigate the spread of COVID-19, and when combined with other public health measures such as screening and hand hygiene, enhanced cleaning and distancing, support healthy and safe school environments. Rest assured that we will regularly review the need for these measures, and we will recommend modifying requirements as soon as it is safe to do so, a decision that will be made collaboratively and based on the best evidence between local school boards and their local public health agencies. But having measures in place means that kids get back to class, go on field trips, and socially interact with their friends with confidence. These measures will help us to ensure that we have a safe and sustained reopening of our schools in the fall. These measures worked during the last school year, and an ever-increasing level of community immunity is only going to increase the strength of these measures. I am confident, as well as my colleagues are confident, in the plan for reopening our schools and our cautious approach to reopening the province. And provided we see an increase in vaccination rates, I am confident Ontario being able to effectively respond to any rise in cases this fall, which may happen as we reopen and as people start to spend more time indoors as the weather changes. I believe we're on the right track in Ontario, but we still have work to do. As we move beyond Step 3, masking in the appropriate settings and staying home when ill and getting tested will help us prevent the spread and save lives moving into the fall. Many jurisdictions, including some areas of British Columbia, Israel, parts of the United States, that have removed masking requirements are now experiencing a rise in cases. Some now are having to reintroduce face covering requirements in public indoor settings. I don't want us to wait till we start to see a rise in cases. I think we should remain persistent and consistent in our messaging until the coast is clear. Instead, we're going to maintain all the simple public health measures to prevent a rise in the Delta strain. And in that, I will turn it over to any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Alison Jones at the Canadian Press.
Oh, hi, Dr. Moore. I wanted to ask about one line in particular in the document. It tells school boards to be prepared for a potential closure, but it doesn't really outline any conditions that would have to be met or any circumstances that would lead to school closures. I know the science table recommended keeping schools open in all but the most catastrophic scenarios. When do you envision schools potentially closing?
Yeah, I really don't see our schools closing going into the fall and winter and spring. And I believe that's the same stance of all of our medical officers of health. We will do our utmost to keep schools open for all students and families. And that will take a multifaceted approach of masking, hand hygiene, distancing, screening on a daily basis, testing and case and contact management, and improvements in ventilation. All of those measures that we're recommending, I think, will keep our schools safe. I really can't envision or see any closure of any schools in Ontario, or colleges, or universities. We must maintain them open going forward. And if I had to compare it to other viruses like influenza, in influenza we anticipate always a rise in cases over the winter months. Sometimes we'll have 10, 15% of students away because they've come down with the virus, but they recover, they resolve, and they're back in the classroom. I think we have to normalize COVID-19 for schools and have an approach that's prudent, that's cautious, but that realizes, yeah, we're going to have a rise in cases, but we're going to adhere to the best practices to minimize the spread and to keep our communities safe.
Follow-up?
I'm just hoping you could touch a little more on the breakthrough cases. You mentioned the stats earlier, but what can you tell us about the people who are fully vaccinated and are getting infected? Are they getting less sick than the unvaccinated people who are getting infected?
Yeah, that's a great question. So breakthrough cases in Ontario seem to be very, very rare. And that would be if you're fully vaccinated plus 14 days and you're exposed to COVID-19. There is the possibility, because the vaccines are around 88% protective against Delta, that you may develop symptoms. The symptoms will be milder, they'll be shorter, they'll resolve quicker. You'll have typically less virus in the front of your nose, and the ability to spread virus will be less. So terrific advantages to be immunized, and less risk for hospitalization, as we've said, and less risk of needing to be in an intensive care unit. So tremendous benefits to being immunized, but there will be, in a small number of those that are fully immunized, those that develop symptoms compatible with COVID-19 who will test positive, but it'll be a shorter illness with less severity, less complications, and less risk of hospitalization.
Next question.
Chris Rashui at Toronto Star, please go ahead.
Oh, hi. Thanks for taking my questions. I was just wondering, with regards to masking in schools, why kindergarten students weren't included in the mandate, and do you expect that kids will be wearing masks all year long?
Number one, we want to keep any public health measure responsive to data. And so if communities in Ontario have very low incidence of disease, very high immunization rates, they, in partnership with their local public health agencies and school boards, could review any public health measures such as requirement for masking. And I just want to shout out, some of the numbers. Leeds Grenville Lanark has an immunization rate first dose of 88.6% of their population. Thunder Bay has achieved 85.6% of their eligible population being immunized. I don't foresee those communities having large outbreaks or large amount of community infections because they've embraced primary prevention through immunization. As a direct result of that, their schools, I think, are going to remain very, very safe. And in those instances, we'll start off cautiously. If they really don't see community activity, so they're below around 10 per 100,000 cases per week, the risk in a school setting will be absolutely minimal, and they could, together with their school boards, feedback from parents, teachers, and children, make a decision to not have mandatory masking in that environment. I do, though, want us all to start off cautiously, prudently, safely with masking in place because of the risk of Delta. But the reassessment of public health measures, I think, should be done on a regular basis to see that they're essential and mandatory. Regarding children from grade 1s to grade 12, the compliance rate may be less in kindergarten students, and we know that their risk of getting any severe complications of COVID to be very, very minimal, and that can be done at a school board level to make that decision. But on a population level, we didn't think it necessary to include that age group in the mandatory masking.
Follow-up?
Okay, thank you. And I also see that there are no set physical distancing requirements in classrooms, and I'm just wondering why that decision was made, and if there was any consideration that maybe elementary students might need it more, given they'll be largely unvaccinated.
Well, the principle that we provided to the Ministry of Education was distance as best you can and minimize the number of contacts each student has within a school setting. So how the Ministry of Education translated that is that they're going to have cohorts of students, so groups of students that will be able to socialize and be monitoring their symptoms on an ongoing basis and reduce the risk of COVID in that group. And so if we ever have to do outbreak investigation, we know there's a defined population that potentially could have been exposed. And it's distancing amongst cohorts, we think, is an essential component to our advice, and that's been adhered to by the Ministry of Education as well. But distancing as best we can. We've all seen children behave in a schoolyard and or in a classroom setting. It's very difficult to minimize the distancing, and that's why it's a multi-component strategy of screening, of testing if you develop symptoms, as well as hand hygiene and masking and distancing. All of them together collectively protect the child in the school environment, and I think the distancing is as best we can.
Question
from Camille Caramelli at Global News. Please go ahead.
Hi, thanks for taking my question. I think one thing that members of your own science table, Dr. Moore, have said that what would have really helped is keeping track of those who are vaccinated within schools, within high school. So, but there's no mandate put into this document for that. Why was that? Why isn't there anything that says or highlights how many students have been vaccinated or whether they've been vaccinated or not?
Oh, great question. So we're tracking at a population level the proportion of high school students in particular that are getting vaccinated, and the numbers are tracking in a very good direction. I think we're at 74% that have chosen to be immunized, and the second doses are following suit. So we'll see those rise as we approach the opening of schools. So that's a good level. I'd love to see it higher than that of protection. If there's ever an outbreak that needs investigation, that's where we'll try to ascertain the status of the individual students or those that have been exposed to understand their risk in that setting. And it has not been included in any immunization policy to date for those age groups. And it will be disclosed, though, if we ever have to investigate. Health units, though, can, on an average for their population, come out with what proportion of students are protected. And to me, we're making very good progress through a non-mandatory means of immunization. I think people are getting the message in the face of Delta, high transmissibility, high risk, and the majority of patients now coming down with COVID-19 being unvaccinated. The message is clear. If you want a safer fall, less risk, less time away from school or work, now's the time to get immunized.
Follow-up?
Thank you for that. But, asking for that information of how many people have been vaccinated within a school after an outbreak, it seems kind of backwards, does it not? Why not get that information right away beforehand or ask for that information beforehand to try and prevent and learn about how safe students are going into a particular school or setting? And sorry, this was actually my second question, but there's also no word of limiting class sizes for elementary or high school classes, which has been a topic of conversation for quite some time now. So why wasn't that included in the document as well?
That might be a question that's more appropriate for the Ministry of Education. For the principles that we've adhered to is try to minimize the total number of contacts of a child in any given day. And I believe Ministry of Education has adopted that through a cohort-type mechanism where we know for the vast majority of the school day who that child has been exposed to and what that risk would be. We hope that that is a very rare occasion. Our schools in the last year have remained safe. We saw very few outbreaks in this class setting. And the best means of protecting our schools, I'll just get back to that, is having a high rate of community immunity and a low rate of disease in the community. And those two have a direct correlation. The higher your immunization rate, the less the risk is going to be in your school setting. So it's a call to arms. Anyone that hasn't been immunized to date, please consider getting immunized. Speak to your healthcare provider if you have any questions. Now's the time as we head into the fall to really reconsider your position and get immunized. It's the safest and best thing you can do for your personal health, for your family, for your school or college, university, or workplace.
Next question.
From Chantal Lee at Globe and Mail. Please go ahead.
Thank you. Hi, Dr. Moore. I wanted to ask you a little bit more about what the testing protocols are going to be in schools in the fall. We're seeing in Alberta that they're doing away with testing. Are we going to go that route, or are we going to take the opposite route, where if a student has, for instance, mild cold symptoms like a runny nose, they'll have to get tested? And if so, how is the province going to ensure minimal disruption in schools and that testing centers won't be overwhelmed?
Oh, well, there were a lot of questions there. So first off, we've heard loud and clear from parents and looked at our testing. We did a lot of testing for very mild symptoms like runny nose, and we found that we didn't get a lot of positives at a population level. So we've narrowed down the symptom list to those that are very specific to COVID-19 for children and adults. So fever, cough, increasing shortness of breath, loss of taste or smell, and in children, vomiting and diarrhea is correlated with COVID-19, new onset. So the symptom list is smaller, so the requirement for testing should be fewer, and hopefully a percentage of tests that are positive would be higher. So less impact on families, less need to go get tested. We've also heard loud and clear from parents that we want a multimodal method of testing. So we're looking at the swish and spit type of test where we can do the PCR test on the saliva. We're also looking at a testing mechanism where you can just do the front of the nose or the inside of the cheek or the back of the throat and not have to do the very back of the nose. And all of that work is being done diligently to ensure that we have a multimodal method of testing available to parents and families. Assessment centers will still remain open in many areas of our province, and we're also partnering with our primary care providers to see if there's a possibility of getting tested in urgent care clinics run by primary care. So I hope that parents are hearing that there'll be less requirement for testing, that we will have a multimodal means of testing, that testing will remain accessible and available to them, and that we've heard their concerns loud and clear. We still want to have testing of children to prevent spread in the school environment, and also the possibility of children bringing it back to their families, and especially multi-generational families that perhaps aren't immunized as of yet. So in Ontario, we still think it's important to have good case and contact management, good early identification of cases, protection of our schools, and over time, we will pull some of these measures away as the incidence and threat of the disease decreases. But we want the safest opening of our schools in the fall. We want our schools to remain open. We want confidence of our families, students in the school system that we've created, and also confidence from the workers that are in that environment, that we want them all protected as best as we can. And over time, as this virus becomes endemic, so a normal seasonal virus, we will decrease all of that capacity, but want to be ready for any rise of Delta in the fall.
Follow up?
That's great. Thank you so much.
There's a lot of questions. I hope I answered.
Last question.
From Sean Cohen at CHCH News.
Hello, Doctor. My question has to do with a potential fourth wave in Ontario and what it could look like. In the UK, weekly cases are decreasing, but the weekly death rates are on the rise, whereas in the US, the weekly cases and the weekly death rates are on the rise. Do you see Ontario following any one of those paths in a potential fourth wave?
Yeah, I mean, it worries me, and it's my job to worry on behalf of all Ontarians. And I met with experts at the science table today to look at, given our level of protection today, the great immunization protection of 80% that we've achieved, what does the fall look like? And we're trying to model that out. We do see a rise of cases through September, potentially rising in October, November, but it's our job as a community to mitigate that, to minimize its impact, in particular on the hospital sector. We don't want people having to be admitted, having to go to our intensive care unit settings, and we want our community to remain safe. And that's why we're being prudent and cautious. We're watching what's going on in UK. I'm watching the daily rates in Alberta and British Columbia and in Los Angeles and in New York and in Florida, and we're trying to learn from them what are the best practices we can put in place. And some of them are very simple. They're wearing a mask in public spaces, on a bus, on the subway, while you're shopping in a mall, as we move indoors. Those are prudent, they're practical, they've shown their effectiveness at decreasing the risk of transmission of this virus, and that's why we're not taking them away and putting them back. We're just going to try to keep them because we all want to return to the new normal and not have a rise of threat of this virus, as well as maintaining the highest immunization rate we can. Those, I think, will be prudent to keep on, but you have my commitment that we will be following the data. And when the coast is clear and the threat is diminished, that we will remove the public health measures. I understand the concerns of people not wanting to have rules forced on them, but we are all in this together. We all depend on each other because this virus can go from person to person to person when we're unmasked or when we're in social settings. I'm asking for everyone to remain kind and caring and compassionate, as Ontarians have been over the last year and a half. We have another 6 months that could be difficult, but we'll get through it together.
Follow-up, and this is the last question.
Thank you. And the follow-up is on the back-to-school plan. This is on behalf of my colleague. Are you able to elaborate on what wind instruments are and perhaps if they include brass instruments for what can be used in schools?
Yeah, so all wind instruments are in, and that would include flutes and clarinets and trombones and trumpets. We're asking for physical distancing in a well-ventilated area, perhaps like a gym or outdoors. This was after feedback from parents, music teachers, Public Health Ontario, the Science Table. We absolutely understand the risk of aerosolization, but if communities keep their risk low, their immunization rates high, everyone screens appropriately on a daily basis, these are risks that I think we should take because they are small risks. We can never eliminate the risk completely. We have to balance our social, mental, physical well-being, and I think music is important to all children, and it's part of the risk reduction strategy we have in play and our desire to have a balanced approach to our schools.
Thanks, everyone.